Ms. Reese, along with the Board of Health Chair Kathleen Bishop, joined the school committee meeting on Thursday night. Segal informed the committee that the latest COVID data for Norwood, which was supposed to be released Thursday afternoon, has been delayed until Friday. The school committee asked the health director her recommendation on how the school department should proceed.
So what do we do now? I would say at this point, stay the course. Really nothing has changed as far as what's going on in the schools from when we spoke last. There are additional cases in the community, but I really don't see any school transmission. We don't see a huge spike in cases of school-age children. We're actually seeing a wider range in ages. So I think part of the problem with describing this disease in our community is it's sort of all over the place. There's no one thing we can point to. There's no one cluster. There's no one activity that is sort of leading to the rise in cases. It's a lot of little things. It's social gatherings. It's some workplaces where people are in close quarters for long periods of time that leads to the spread. There's such a variety of sources. There's not one thing I can point to that says, 50% of Norwood's cases are coming from this activity or that workplace or this industry. And I think the state is working to try and really characterize the cases by trying to release cluster data. But if last week they started to release that data, and you can really see it's a smattering of different things. And I think, COVID's throughout our community and it's showing up in different spaces. And there's really not one thing we can point to, which is uneasy. That's not a good feeling. We really want to pin down what activities lead to the transmission, but we just can't. It's just kind of all over the place.
Segal also noted that Norwood has a high testing rate with low positive case numbers and no in-school transmissions.
And I just, I keep harping on that we're not seeing the transmission in the schools, and that we're probably at the same place why the community case numbers has gone up. I think that's one indicator. Our testing rates are high, our percent positive is pretty low, and there's no in-school transmission. So I think looking at all those data points are important.